Okay, so picking up where we left off with our lecture last segment, I was talking about prevention and management for these particular areas with microvascular disease. And as a reminder, this microvascular disease is largely caused by the needing to clear of the glucose, which then results in atherosclerotic lesions both in macrovascular and microvascular tissues. So prevention and management, we really recommend that individuals that have diabetes have periodic dilated eye exams and get renal function tests, and to really have optimal blood glucose and blood pressure control. And in order to do that, we strongly recommend controlling their weight, being physically active, and eating a healthy diet as well, on top of possibly needing insulin or other pharmaceuticals, depending on how dire their condition is. The one thing that we do have to be careful of with the exercise prescription, and this is why I would highly recommend healthcare professionals working with exercise physiologists, particularly clinical exercise physiologists. And there are resources for you to find them. The American College of Sports Medicine has if you go to their website, they have a link to find people in your area that are certified. They also have an exercises medicine initiative to help practitioners utilize resources from exercise physiologists in their scope of practice. They are trained in working not only with getting people to be exercising within their clinical conditions, but they're also trained and skilled in dietary interventions that are just sort of standard dietary interventions, weight loss, and in behavior change strategies. So they can really work with patients and helping them to move forward in actually adhering to these lifestyle changes. And of course, public health professionals are a key component in developing educational materials and aspects to help guide your intervention in these ways. And that's part of what your assignment is to pick a disease and then start to research pre-made educational materials. And the reason for that is so that you can become skilled in your ability to do that. And I would encourage you in your practice to have a file cabinet if you're in if you're in primary care practice, you may need to have a file cabinet for every disease state, but you want to have these materials that are readily available to give to patients for them to take home and read. And a lot of that is already pre-made by these organizations. And this public health professionals in particular make these, and it helps them to have that information, read through it more, and also gives them links for further resources. And that's really important. Just telling a patient to do something and having them walk out without something in their hand becomes less of a value to them than if they have something in their hand. Represents sort of to them a prescription, and that prescription then leads to a higher likelihood of actually engaging in change. So that's just a little bit really important to kind of be thinking about. And if you're interested in a little bit more on how to do this kind of thing, we offer a class in the fall called Health Promotion Disease Prevention, where we work on developing educational materials and interventions for certain disease states, any really disease state as well. So I wanted to show you a picture here. This is this is a normal retina, and so I want you to kind of see diabetic retinopathy. And this is a normal retina, and you can see the optic nerve is nice and clear. You have the macula back here, retinal blood vessels. Everything just looks nice and pretty, right? It's just kind of a healthy eye here. When you look at diabetic retinopathy, what you're going to be seeing is neurovascularization. So if you look over here by where the optic nerve is, it's difficult to see because there's all of this extra vascularization taking place, and that's because a lot of these vessels are getting blocked and dying, and so they need to revascularize. In there, we're starting to see these little edema, micro aneurysms kind of things occurring through here. And then you start to see these cotton wool spots, and this cotton wool spots is what causes the blindness and the blurry visions, because it's starting to result in the patient being unable to or the death of sort of the tissue around there. And I was actually able to work with my my eye doctor, and he was able to give me some actual images here. So what you're seeing up here, thankfully, I have a normal eye. So this is actually my eye through those images that the optic images that they take. So you can see my optic nerve and the vascularization that's occurring through there. And when you look down here, you can see that this one right here is an individual that has diabetic retinopathy. And you can see the cotton wool aspects occurring through there. You can see some of the little spots or squiggly lines of needed of those micro aneurysm kind of things. You're beginning to see just sort of a cloudiness of the eye, right? It's just kind of cloudy. We can still see the optic nerve, so it's not highly advanced here, but you can begin to see some levels of vascularization occurring outside of that to do that. But you can clearly see some of those cotton wool and other kind of things that are not present over here. So this is an example sort of what you would kind of be seeing in the individual then who has diabetic retinopathy would be seeing like this, okay, where it has some blurry spots, dark spots. These are their cotton wool where they're actually not able to see anything at all, and definitely blurry and cloudy vision. Now, some of us have to have contacts because we have blurry vision as well, but we still, with our glasses and contacts, we see like this. Individuals, even with those, would be having some blurry and really black spots that they would be seeing within this diabetic retinopathy. Neuropathy can occur both peripherally and we're going to take a look at peripheral neuropathy here in a few minutes. But basically what this has is it affects your legs typically before their hands. And this is why it's also really important. We're going to talk about getting a proper foot exam for these individuals, because this is what often leads to amputations. Is because they lose feeling in their feet. They don't recognize when they injure their foot. Their feet end up getting infected and oftentimes can move into gangrene. And then if they're not able to control that infection, it gets to be a little bit more difficult. And neuropathy is when nerves do not work properly, right? And so the individual is initially going to experience sensory symptoms and loss of tendon reflexes. And we are going to take a look at sort of what some of that stuff is. So with the sensory symptoms, we have paresthesia, which is a burning, prickling, itchy, tingling, or pinpricks with no apparent physical cause. Hyperesthesia is an extreme sensitivity of one's body sense organs, such as pain or touch receptors, so extremely sensitive in those kind of things. And also they may feel burning sensation. As it gets more complicated, it progresses where the feet become numb. And this again can result in foot deformities, causing areas to receive increased pressure from shoe wear or foot strikes, leads to a high risk for foot injuries. They have a difficulty then realizing it, and it can then lead to possible foot amputations later on. Muscle weakness and atrophy may also occur, and so there is a large number of lower limb amputations because of this. They have a loss of sensation, puts them at risk for injury from diminished circulation, particularly related to that peripheral artery disease that we talked about before. This impairs healing, leads to severe reductions in blood flow, potential gangrene and amputation, not to mention the possibility of infection. So they have to have proper instruction when it comes to this particular area. And one of the things we focus on really is how to examine their feet and how to practice good foot care, especially when doing exercise. So again, if an individual is diabetic, it's not that we don't want, and they have peripheral neuropathy, exercise is still one of the things we want them to do. This is really key, but we want to work on how they go about doing foot care and the proper shoes and things like that. Increased walking and cycle pedaling can increase the risk of their foot injury. So it's not that we don't want them, again, to do it. We want them to be better aware of it. But overall, they still need to have better foot care in general. So autonomic, this can occur in any system of the body. Cardiovascular autonomic neuropathy results in, is manifested by high resting heart rate, attenuated exercise heart rate response. So again, we have to be careful here. Abnormal blood flow or abnormal blood pressure, and the combination with severity can limit their physical functioning and their exercise capacity. So if they have autonomic neuropathy, again, it's not that they can't exercise, but it is going to be a challenge for them. And, something they have to consider because of their inability to do some physical functioning. So again, something like a clinical exercise physiologist may be helpful here for individuals to be able to help them, guide them in this process. Again, it can occur in any body system: cardiovascular, respiratory, neuroendocrine, gastrointestinal. Many of these systems are integral in their ability to do, life functioning. So we want to be careful with that, but we also want to help them recognize what some of these kind of things are. So some other signs and symptoms of diabetes would be excessive thirst, frequent urination. A lot of times it's an unexplained weight loss, slow healing, blurry vision, high fatigue can be in there. Type 1 diabetics can have some or all of these. Type 2 may remain asymptomatic for many, many years. This is why it often goes undiagnosed, because they don't really know it's happening. And unless they go for a yearly checkup and get their glucose checked, it's not something that they're going to see. And again, a quarter of those with diabetes don't even know that they have the disease. So how do we go about diagnosing it? What are some things that we want to consider when we're talking with individuals that have these types, might have diabetes? We want to look at medical history, and again, look at acute and chronic complications and what stage it occurs. Look at lab values, blood pressure. Ask them if they're self-monitoring their blood pressure, or blood glucose, Work with them on body weight and BMI. Talk to them about medication use and timing, particularly with exercise. So I'm going to talk to you a little bit about that because that's a treatment strategy. Exercise history, nutrition plan, and then other non-diabetic related health issues, just a kind of a general idea. Is there anything outside of diabetes that we have to be concerned about as well? They should have physical exams regularly to look for resting heart rate, any loss of sensation, poorly healing sores or ulcers, any excessive bruising, or any retinal vascular abnormalities. So they should be regularly visiting their physician in order to check on these kind of things. Proteinuria is a urine contains abnormal amounts of protein. This can be a sign of chronic kidney disease, which can be from both diabetes or hypertension. So this is another lab that is often tested. So the American Diabetes Association really talks about testing for diabetes in all overweight BMI adults. So anyone that has an overweight or obese category should be tested for diabetes. We also want to look for additional risk factors such as physical inactivity, first-degree relatives, if they're a member of a high-risk ethnic group, again, delivered a baby or that was over 9 pounds or diagnosed with gestational diabetes, hypertension, has low HDL or high triglycerides, maybe has glucose levels that put them in pre-diabetic stage, polycystic ovarian syndrome, because polycystic ovarian syndrome, it's kind of a chicken or the egg. We don't know if it's PCOS that causes obesity or obesity causes PCOS. We've seen an increased rise of PCOS in our country recently, but we think that could largely be due to the obesity epidemic, less so than the other way around. So we're thinking a large portion of the cases are due to obesity, but it's difficult to determine. But this causes metabolic disruptions, and one of those metabolic disruptions could be irregulation of insulin and glucose. So other clinical conditions that might have insulin resistance and any history of cardiovascular disease. And so what we do to test this, we'll pick this up in